I'm Dr. David Rowe, and today's discussion is about the Gonstead Technique. Now, there's no one single component of chiropractic or of my chiropractic career that's as near and dear to me as the Gonstead Technique. The Gonstead Technique was developed by and is named after Dr. Clarence Gonstead of Wisconsin, and he developed a specific way of analyzing the spine, and then based upon how he analyzed the spine, a way of correcting spinal subluxation. Its basic foundations, it is a osseous adjusting technique. He's actually moving individual bones. It is intersegmental, which is to say that he's not looking as much as correcting posture like we do in chiropractic biophysics. He's more like, how do you adjust that specific subluxation? How does the L5 sit on the sacrum? How does the T6 sit on top of the T7? How can we analyze it and correct it? Now, Dr. Gonstead developed this system, and it really is a system of both analysis, adjusting, and case management. How do you care for patients over time? He developed this and documented it and taught many chiropractors over the literally decades of how to replicate his process and his results. Now, I got interested in the Gonstead Technique when I was just a student at Life Chiropractic College. I was just a few months into school. I got exposed to it, started to study it, got so excited by its scientific approach, by its specificity, and we'll talk about that a lot, about how accurate and specific can we be in both the analysis and the correction. And I continued my development, learning the Gonstead Technique for literally my entire career, and we're still working at it 43 years later. We have integrated other techniques into our program at Rowe Chiropractic offices, but today is just we want to focus about what is the Gonstead Technique and how is it differentiated from other techniques, and what makes it so great, and how do we use it to best benefit our patients. Now, in the analysis in the Gonstead Technique, they're using different criteria to evaluate what a subluxation is. First, they're looking at inspection. They're doing a visualization of the patient. They look at posture, but very much they're looking at what is the integrity of the spine in terms of skin changes, in terms of swelling, in terms of posture. So for the vast majority of Gonstead practitioners, they either gown their patients, or with men, they have shirts off, because you're actually looking at the skin. There's a tremendous amount of information that can be gained in the analysis of spinal subluxation. So the first thing is inspection. The second component of analysis, how do we find the subluxation, is digital palpation. We mean digital, like how does a doctor feel with their fingers and feel certain changes in spinal integrity, we'll put it that way, where we would feel for swelling. We would feel for where the tissue is extra oily or extra dry? Do we feel a mushiness, an atrophy in the tissue? The Gonstead Technique uses this criteria of digital analysis to help evaluate, to locate what is the subluxation, and they kind of describe it as what's the sick vertebra? Where is this problem itself? The next part of the analysis is using an instrument, a heat reading instrument, to detect areas of spinal nerve dysfunction. Now, these heat reading instruments have been used to locate the actual level of the stress nerve. When we're talking about instrumentation, it's the use of an instrument, and this is an old school nervoscope. There's nervoscopes and there's temposcopes, and these are a bilateral heat differential. It's basically comparing what's the temperature of one side of the spine to the other. The instrument guides us into areas of nerve dysfunction. Now, when we glide the instrument on a person's spine, it actually creates a little bit of a stimuli, and you'll get a reading. But if you keep gliding that instrument, if the tissue is normal, that reading will change because you're actually stimulating the skin, and those nerve endings on the skin open up capillary beds and bring more blood to the surface. So it'll actually create a change in the temperature reading. But areas of subluxation where the nerve is deadened or is dysfunction, you could keep going over that, but you'll get the same reading. It gives us an indication that there's a nerve interference or a nerve blockage there. So the third criteria of the Gonstead system is actually looking at the instrument to evaluate. So here we've looked for for visualization. We've looked for with digital palpation. And the third one is instrumentation. There's a lot of different instruments that have been used over the years. The typical one is the nervoscope and the temposcope, but there's other instruments that have proven very valuable, and different Gonstead doctors use these different instruments. Okay. The fourth criteria is looking at an X-ray. Now, in the Gonstead system, the typical X-ray study is a front and side full spine X-ray. Since we're looking intersegmentally, just the relationship of one vertebra to the other, even in X-rays where there's heavy postural distortion, the relationship of two vertebrae, because they're so close together, it gives us a very accurate evaluation on what's the position. So in the X-ray, we're looking at what's the relationship of one vertebra, typically to the vertebra that it's sitting on top of. So the fourth criteria in the Gonstead system is X-ray imaging, and it's typically done with a front and a side view full spine. Stop with it. The fourth criteria in the Gonstead system for analysis is motion palpation. Now, we describe digital palpation or static palpation as a way to evaluate tissue integrity. But motion palpation is different. Motion palpation is a way that we feel for the normal motion of the spine. We know that a healthy joint has a certain amount of equal symmetrical movement, that the right and left should be fairly similar. But when vertebrae subluxate out of their normal position, in the Gonstead model, they misalign and get stuck there. So when we say get stuck, they lose the normal flexibility. So the joint becomes fixated in the direction that it's misaligned. If it had normal motion, then the brain would go ahead and reboot it, and the spine would realign back to its normal position. But when the vertebra gets stuck, it's fixated in that position. Now, what makes a joint stuck? Scar tissue adhesions, fibrosis, asymmetry in the joint itself will change the mechanics. But it's more, and yes, some muscle tightening, but it's mostly a ligament and disc phenomenon that changes the motion. In the Gonstead system, they're evaluating the motion to help us find the individual subluxated segment, but also to say, okay, it's misaligned in that direction, but it's misaligned and stuck. So motion palpation evaluates the movement that helps give us the sense about how is that vertebra misaligned. But the direction of misalignment in the Gonstead system is really evaluated from the fifth criteria, which is the X-ray. Now, the specific X-rays that are taken in the Gonstead system are a front and a side full spine X-ray. We look at every vertebra in the spine, including the pelvis, to see how is it positioned and how are the curves from the side. But most importantly, since Gonstead is an intersegmental technique, they're evaluating what's the relationship of one vertebra to the vertebra that it's sitting on. So let's go through the criteria again. We've got inspection or visualization. We've got digital palpation, or called static palpation. We've got instrumentation, where we're looking for changes in normal nerve flow. We've got motion palpation, that's evaluating the movement. And we've got the X-ray study that helps us evaluate the position. All of these five criteria are utilized to different degrees, but essentially you're doing this with every patient to figure out what is the primary subluxation. Then based upon once we choose the subluxation, then we use the Gonstead adjusting technique to actually correct it. But they're the five criteria for evaluating the subluxation. Hi, I'm Dr. David Rowe, and today's topic is the Gonstead system. Now, the Gonstead system is a chiropractic system of analysis and correction developed by Dr. Clarence Gonstead. There's no one component of chiropractic that is more near and dear to my heart than Gonstead, because it was the first technique that I really learned, and it gave me such an amazing tool to be able to help patients and to work with patients of all ages, of all different types of spinal configurations, of all different types of health concerns. The Gonstead system helped tremendously. Now, the Gonstead, when we say a system, it's an analysis, a correction of how do we adjust, as well as a case management. Let's talk about the analysis first. In the analysis of the Gonstead system, they're using 5 basic criteria. The first one is visualization. We look at the patient. We see, What's the posture like? We're looking actually at this on the spinal skin to see if there's changes in redness or changes in whiteness. We're using visualization to evaluate the patient. The second one is static or digital palpation, where the chiropractor is feeling the spine for tissue integrity. Is the spine swollen? Is it oily? Is it dry? We're using palpation to evaluate tissue integrity. The next piece is instrumentation. We use these bilateral heat instruments to evaluate changes in normal temperature from right to left side of the spine. That change in temperature is commonly linked to nerve compression or nerve interference so that the nerve doesn't send a normal signal. The fourth piece is motion palpation. We're still using our fingers, but now we're not evaluating just tissue integrity. We're evaluating the integrity of motion. Does the vertebra have its normal flexibility? Does it move? Is it stuck? Is it fixated? Does it move too much? But usually the subluxation is that we're looking for the vertebra that's misaligned and stuck. And the last component of our analysis is the X-ray. In the Gonstead system, we use a very specific X-ray setup. We do a front and a side full spine X-ray. So there's typically 2 X-rays taken. The analysis in the Gonstead system is to be as specific as possible to find out what vertebra have misaligned out of their normal position, gotten stuck there, caused swelling, put pressure on the nerves, and interfered with the nerve's ability to send a normal signal. That's the analysis in the Gonstead system.